Hello, everyone, and welcome once again to the Blood Sugar Challenge. My name is Noha, and I have started a blood sugar challenge to bring down my blood sugar in a natural way. I have made a couple of videos prior to this one. If you haven't watched any of them, don't worry, because I usually start with a summary. So let's just jump right into it. So the gist of this blood sugar challenge is a natural way to bring down blood sugar. And in my case, I would like to bring it down to a 4.5 in a duration of 30 weeks. If you recall from previous times, I did have a conversation with the GP and my doctor said, basically, you can bring it down in a natural way. You don't need medication to do so. So what does bringing it down in a natural way mean? It basically means focusing on predominantly three main areas of life. The first one is, of course, diet. We all love food, but it's got the good and the bad and the ugly about it. The second one is around physical activity and exercise. The third one is around stress levels. And yes, a lot of people ask me, why is stress involved in this? There is current research to prove that the higher the stress that we have in life, then the more adverse impact on blood sugar it has on us. And I don't mean the positive kind of stress, I mean the sort of constant stress that we may encounter in life. We can talk about that later, but for now, this is just a reminder, three key areas to bring down your blood sugar naturally. If you recall, prior to the challenge, which is now on week 2, I measured 7.7 in week 0. So before the challenge, it was as high as 7.7. If I just go by this measurement, then it means that I am diabetic and I've crossed that threshold from being pre-diabetic to diabetic already. But that's okay, because I can reverse this condition based on modern science and based on what my doctor is telling me. If you can recall, and there's pure evidence to what I just said, is that on week 1, which is last week, I measured 6.3. So to go from a 7.7 to 6.3 without medication, just focusing on my lifestyle, the key 3 areas, is proof that this is something that we can improve on, as long as your healthcare provider tells you that you can do this through lifestyle changes and that you don't require medication. If they say otherwise, then you may need to follow a different path if you want to have your own challenge. For this week, and just like last week, I am tracking these 3 elements, and under food, I've categorized food under green, amber, and red. And the first category of green, usually you have the group of foods that does not spike blood sugar. At the top of the list, of course, is vegetables and leafy greens, and proteins and fats. And then the third, complex carbs and fruits. As you can see, it hasn't changed that much from last week. So this is the food group that I'm proud about. The second grouping is amber, which is groups of food that can spike your blood sugar if eaten in big portions. In this case, I've eaten very small portions of these foods, but still I think they do impact blood sugar. So the first one is home-baked gluten-free bread. It was predominantly made of lentils, so it's low-carb bread. You can easily make this at home, even if you don't have lentil flour. I can share with you the recipe if you're interested. The second one is popcorn. As I said last time, for some people, it doesn't spike blood sugar. For me, it does if I eat a little bit more of a quantity of it. And usually I can't stop with a small quantity. So that is something I need to monitor. Dark chocolate, I only had like a couple of slices of dark chocolate, so very small amount, but still it has sugar, so I need to watch out. Peanut butter, this is a new thing that I'm experimenting with as to the impact it will have on my blood sugar, provided that I get the sugar-free type. The third area is the red one, which is anything here, even in small quantities, can spike your blood sugar. And the first one is Vietnamese rice paper rolls. There is a variety with low carb, but in this case, I went for the normal one, and I could immediately feel a spike in blood sugar after eating it. And you can tell if your energy levels drop, if you're feeling a bit thirsty, and going a little bit often to the bathroom. So that's basically something to watch out for, and I think I need to keep an eye on. The second one is dolmadas. In Egyptian culture, we call it wara ainab, and again, it has lots of rice. And you can, if you've ever had any of that, of dolmadas, then you know that one is not enough. So it's hard to control yourself when they're around, and they can spike your blood sugar because of the rice content. So if you can see, both of them have rice content, and I think I need to watch out for rice moving forward. It's something I enjoy eating, but spikes the blood sugar. In terms of, if I move on to stress levels in this week, it was medium, which is an improvement from last week, which was borderline medium high. And I think that the fact that there was a public holiday this week did help to bring a little bit more relaxation to the week. In terms of activity levels, unfortunately, I did less than last week. Last week I did 4 hours. This week I fell short by 30 minutes, so 3 hours and a half of moderate walking. In terms of other factors that may have an impact on my blood sugar levels, I have recovered from COVID, but I think it took an additional week, all of last week, to battle the impact of long COVID that it leaves behind. Anyway, I'm feeling great now, so that's something to just note. But moving forward, I will be removing the impact of COVID from the other factors. Now, a combination of all of that has led to a measurement of blood sugar, and this is my measurement this morning. It is 6.0. So it is 0.3 less than last week, which is great. Means the curve is going in the right trajectory, going down, and I'm moving in the right direction. And again, the target is 4.5. Moving forward, I'm going to be using a blood sugar monitor. It is a continuous monitor, which means that anytime I have any of the food groups that I mentioned earlier, it will indicate to me whether it has a positive or a negative impact on my blood sugar. And if something spikes blood sugar above a certain range, it can give me an indication. So I've just ordered it. It hasn't arrived yet. As soon as I get it, I will be incorporating my notes here and sharing my experience with you. So this is it for this week, and I hope you have enjoyed this session, and I hope that you are doing great and keeping a close eye on your blood sugar levels. And if you're starting a challenge like me, please let me know, and we can share our experiences and learn from each other. Thank you. I hope you have a great week. Thank you.